Yes, guys. Hello. We will now look into the West Nile. Now, guys, this has become a hot topic of discussion because as on the 8th of May 2024, we are having 10 cases in your Kerala, in Thrissur and Kozhikode. That is the reason this is the hot topic of discussion which all of you should be knowing. The first thing is why the name? Why the name West Nile? Yes. If you apply common sense, you can easily say the reason it is called West Nile because it was discovered west of Nile. Yes, that's what there is no other senseful reason to it. Yes, absolutely right. This is the main reason. Okay, because this was discovered in the West Nile district of Uganda in the year 1937. In the year 1937 and was found in birds in the West Nile Delta. In the West Nile Delta, and that is the reason 1953 this was coined as West Nile. Okay, this was coined as West Nile. Okay, so any teacher would be interested to ask you why it is called West Nile. Now, the agent. The agent for this is a group B arbovirus, that is of the family Flaviviridae. Under this we have West Nile virus, Japanese encephalitis, yellow fever, St. Louis encephalitis. Yes, St. Louis encephalitis. This is endemic in Africa. Yes, Middle East. And that's the reason common in Kerala because there is lot of professional migration which occurs from Kerala to Middle East. Yes, Southwest Asia. And interestingly, it is also endemic in India. Okay. Now, if you look into the life cycle is very simple. Mosquito is my vector. It goes to the bird. The bird is the reservoir. And again to the mosquito. Which mosquito? Cute mosquito. That is Culex. That is Culex. So it is spread by the Culex bite. So if you look into the spread, the most common is bite of Culex. Yes, guys. The other rarer ones are contact with infected animal, that is blood, also by human organ transplant, also by blood transfusions. It can come in the breast milk. Yes, and even there is a report of only one case of transplacental spread, but these are rare If you want to remember, it's okay. Otherwise, you just remember it is due to bite of culex. Okay. Now, what is the clinical feature? The clinical feature is nothing to worry as such. Why? 80% are asymptomatic. Yes, only 20% presents with symptoms. Okay, what kind of symptoms? Typical viral arboviral type. Yes, malaise, headache, fever, typical of those symptoms. Yes, in children, it can also present with a maculopapular rash. Yes, and in aged, fetal meningoencephalitis. Fetal meningoencephalitis. That is the neuroinvasive variant. The neuroinvasive variant. Okay, guys. So nothing to worry. The treatment is just supportive. Yes, no vaccine is available. Now I just forgot to tell you that the incubation period is 3 to 14 days. Okay, guys, 3 to 14 days, and there is no human to human transmission. There is no human to human transmission. Okay. Now, from the programmatic view, the program which is handling this is the National Vector-Borne Disease Control Program, and in this we are going to follow the Japanese encephalitis, acute encephalitis syndrome guidelines. Yes, so nothing special, just it is a public health news which is flaring up in the Indian media. That's the reason, guys, you should be knowing it. I hope I am clear with it. So tomorrow when your professor asks you about West Nile, you should at least tell this much and get the accolades.